Hello, I'm working in Konya Provincial Hospital. My name is Tuğba. First of all, thank you very much, Mr. Hurshid, for contributing to this session. I also would like to thank to the participants, valuable participants. And after having introduced the AI, I would like to talk about the risk estimation, and I would like to talk about how AI is used and whether we can prevent the psychiatric diseases. This is where this reason I prepared this presentation, and then AI tools in risk estimation and early diagnosis. I will talk about it, and I will also talk about the machine learning and NLP, and also narrative and text analysis and digital phenotyping and genetic and analysis. I will talk about, and finally, I will complete my presentation. And generally, in psychiatric disorders, the early intervention is important for the prevention of the diseases as well as and the traditional traditional applications, there's a subjective approach, but in psychiatric cases, the symptoms overlap, and as well as because of the differences in the clinicians, there might be inconsistency, and then we can think about this. In the recent years, with the development of AI, artificial intelligence, in risk estimation as well as in the preventive mental health problems, this might be an helping tool. And these AI supported approaches, there are different subcategories, electronic registries, and the text and analysis and mobile sensory data are all integrated, and accordingly in psychiatric disorders and subjective objective type of evaluation could be done, and machine learning and digital phenotype devices and multimodal data integration are the subtypes. And in 2025, with an meta-analysis which is comprehensive, the AI-based models in terms of definition of the psychiatric problems, there has been a 95% accuracy, and especially in machine learning, the highest accuracy is with this, and then had the hybrid models, and then deep learning methods afterwards following this would help in diagnosis of the psychiatric problems. And then the machine learning, perhaps all through the Congress, it has been mentioned how it operates. First, the data are collected and prepared, and then electronic registries, health registers, and also diagnosis codes, the use of the drug, gender, and age inputs are collected, and then a data pool is organized, and then these are cleaned and then prepared, and then algorithms would processes, and then there is a training, and we train the model. For example, for we have the patients with depression diagnosis and without this, and then we label these patients, and then the machine learns about this, and afterwards there's the estimation. This time, a normal individual is given without a labeling, and then whether the machine would detect the patient right or not, and then afterwards we evaluate the performance of the model. As I have just mentioned, it's about such and such percentage accuracy. So there are parameters, the accuracy and the accuracy of the system, and so likewise. And there are three sub categories. One of them is controlled inspected learning. So we said that this patient is a depression patient, and then there's a self-harming, and then the next data are to be processed accordingly. And in the uncontrolled learning, we do not do any labeling, and the system is within the system and categorize the data accordingly. And there's also consolidated consolidated learning, but in psychiatry there's no place for that yet. And for the machine learning in the psychiatric studies, for example, 1,800 patients were taken into the study where the emergency department study was carried on, and then these people were estimated to find out their probability of committing suicide. And we see that these machine learning models have reached more accurate results, and also the electronic health register systems, the high risk patients were identified, and this system has been found to be effective. In another model, inter-risk model was developed with screening within 90 days, or the in estimation of the suicides have been predicted. So these machine learning and electronic health data registry screening contributes to the possibility of committing suicide. And also Empire's machine learning, schizophrenia was detected to be by 87%. And in another study that was done with the schizophrenia patients, in the first episode, these schizophrenia patients not using in the first stage, not using drugs, we see that antipsychotic response has been detected, has been identified, and then with a machine learning based model, the person's intention or for committing suicide was estimated to be estimated by 80-90% right, accurate. And also the other one is the NLP, natural language processing and text speech analysis. And this is a model, and especially depression for psychotic symptoms as well as for suicidal intentions with the verbal and oral verbal symptoms take into consideration the people's stance. The mood disorders can be identified in 2016 to 2021. A systematic compilation has been identified. 34 researchers were 34 researchers were identified, and then signaling was analyzed, and as a result, the most Twitter is the one the most examined, and Twitter is prominent, and as a result of this platform, and we see the support and vector systems as a machine learning, and the social media data with the machine learning, they are and for the community-based society community screening, it would be used. And once again, in another research, the early signals of depression could be caught with this platform because of the speech and because of the word selection of the patients, and it would help the clinical depression by high accuracy, and also in order to identify the suicidal intentions, and also 80 to 90% the suicidal intention can be detected. And also in the studies, it was the NLP methods have been found to be effective, and also the studies were carried out on children as well. Anxiety, depression symptoms could be identified, and automatic speech analysis is used, and in order to estimate the psychosis, the speakers' speeches were transcribed, and then the psychiatric disorders in diagnosis. AI supported programs can be used in our clinic. And once again, with neuroimaging-based analysis, there are certain data. ADHD, in terms of the ADHD, there's a study done, and these patients who have ADHD, they are predisposed to form substance usage, and short and long-term memory was used, and then the brain parts were analyzed separately, and also visual and ADHD was diagnosed, and also support vector systems were classified, and also ADHD helped to separate it from the obstructive sleep apnea. The symptoms of obstructive sleep apnea can coincide and intersect with the symptoms of the ADHD, and in turn, the AI would certainly help for the detection of certain diseases. And also in an MRI study, which was done in which is a multi-central study, we see that there is 70% of accuracy, and in major depression fMRI studies were carried out, and a machine learning model was developed with the deep learning model. Early time detection of the depression was detected, and also these are taken into consideration, and dorsolateral prefrontal limbic regions. Different functions have been identified, and once again, within 2 years of follow-up, 78% of them with depression were identified. And another one is the digital phenotyping, mobile and wearable devices. And in digital phenotyping, the data are analyzed and psychiatric situations are evaluated. And these wearable devices, accordingly, the mobility, the sleep, and then the socializing, and their speech, the number of the steps, the SMS, peripheral temperature, all these can be collected, and these are used for this in a research in the review of 29 studies, especially these wearable devices would detect the mood disorders, anxiety disorders, and mood disorders and anxiety disorders. And once again, these related to wearable devices with a big scale study in a sample of 10,000 people with the questionnaires and wearable devices, depression, anxiety symptoms were identified. This is physical activity, sleep order, and between these factors, there has been found to be a significant relation. And also genetic and genomic analysis with the AI, the relation, we have limited literature in this. And 21 studies were systematically reviewed, and in estimation of schizophrenia, and titering or stopping the drugs, and classification of the schizophrenia, and to estimate the survival, these AI data were integrated. And with we see that, and also there were, as a result, digital phenotyping, neuroimaging, and genetic analysis are important and promising for the predicting of the mental health. And also the machine learning has got a high accuracy. However, these technologies, to be integrated into the clinics, we need to have ethical based and longitudinal as well as multi-center studies. And in future, we know that there would be an integration with technology. Thank you.